Well, thank you very much, Mr. Chairman, and thank you so much to our witnesses for joining us once again today. Before we begin, I do want to take a personal moment to acknowledge the passing of Justice Ginsburg, a friend, a role model, and a woman who opened doors for all of us with her genius and her relentless pursuit of justice, freedom, and equality. This appointment to our nation's highest court could not be more pivotal, especially as we face down an historic public health crisis. We are in the middle of a pandemic that has cost more than 200,000 American lives on this administration's watch, has left nearly 7 million people across our country with new pre-existing conditions, and 5.4 million people without coverage. Yet none of that has stopped Republicans from using every tool at their disposal, including the Supreme Court, to attack health care and protections for families across our country. I'm not going to let anyone forget many of the same Republicans who are considering filling this vacancy with a nominee virtually guaranteed to tip the balance of the court against people's health care in the critical case coming up this year. Previously said in March of 2016, the American people should have a voice in the selection of the next justice, and said many times over the past few years they support protections for pre-existing conditions. The entire country is going to be hearing about what another Supreme Court nominee handpicked by President Trump would mean for their health care and their rights. Now to today's hearing. Back in January, I worked to help organize the first bipartisan briefings with the administration officials about the COVID-19 threat. And I wrote to Secretary Azar shortly after, asking what steps we were taking, and specifically asking about our diagnostic testing capacity. At a hearing in February, I pressed him directly about issues with those tests, and I asked him point blank if our country was ready. Tragically, the clearest answer I got to that question did not come from the Trump administration. It came back from families in my home state of Washington, and it came as a resounding no. By March, I was hearing from people in my state who believed they'd been exposed but could not get tested, and who had been tested but were left waiting for results. I was hearing from schools in my state, including my granddaughters, that they were canceling classes and closing schools. And I was seeing nothing from the Trump administration to inspire confidence or to act with urgency. Let's be clear, we had a window to prepare for this, and the administration missed it. We had a pandemic playbook that warned against some of the very problems we were facing. They ignored it. We had a clear understanding of how dangerous this disease could be, and they downplayed it. So much has changed since those early days of this crisis. Now the number of people infected in our country has passed 6.5 million. The number of people killed passed 200,000. The number of people without a job and without health insurance has skyrocketed, and businesses have been shuttered. Gatherings, from weddings to birthdays to graduations to funerals, have been delayed or canceled. But one thing has not changed. President Trump is still putting politics ahead of public health. He is still downplaying this crisis and falsely claiming it will just go away or we're turning the final corner, when the reality is cases and deaths are still alarmingly high. Testing and contact tracing are frustratingly inadequate. The health disparities Black, Latino, and tribal communities and other communities of color face are still severe. And we need to prepare for the upcoming flu season, when experts warn us we could see another wave of cases. And yet President Trump is still trying to sabotage the work of our scientists and public health experts for his own political ends. As the leaders of health agencies on the front line of our response to this pandemic, our witnesses have an important firsthand perspective on this interference. Dr. Hahn, the Food and Drug Administration, has a critical role to play in evaluating the safety and efficacy of treatments, diagnostics, and vaccines. The American people are counting on you to uphold sound scientific principles and the work of agency specialists, scientists. So it is incredibly alarming that this administration has undermined public trust in the work of your agency by spreading conspiracies and pressuring the agency to ignore the science. Earlier this year, the administration dangerously promoted hydroxychloroquine, an unproven treatment for COVID-19. But even more recently, the administration pressured FDA to rush through an emergency use authorization for convalescent plasma therapy. And last month, Secretary Azar reportedly overruled you directly and undermined FDA's authority when he loosened oversight of lab-developed tests, a move that allows unreliable tests to flood the market. Then last week, Secretary Azar further undercut your agency by completely barring FDA from signing any new rules without his approval, an alarming power grab for a political appointee to make in the middle of a pandemic. Dr. Redfield, the Centers for Disease Control and Prevention, plays a critical role providing data and science-based public health guidance that our families, public health professionals, researchers, and healthcare providers rely on for life and death decisions. Yet, the Trump administration has repeatedly and recklessly interfered with those efforts. We have seen the White House block and contradict critical guidance on reopening for communities and returning to school. We have seen the president spread conspiracies about the death count and misinformation about masks. And the Trump administration officials have reportedly taken unprecedented steps to hijack the CDC's trusted voice and undermine its credibility. The administration ignored the objection of CDC scientists and posted guidance under CDC's name, advising restricted access to testing, a move that was immediately criticized by public health experts and has since, thankfully, been reversed. Political appointees have demanded to oversee and manipulate the agency's morbidity and mortality weekly reports. And last week, you confirmed the administration took hundreds of millions of dollars out of your budget for a feel-good pandemic ad campaign spearheaded by a Trump official that believed CDC was part of a, quote, deep state conspiracy, in which CDC inexplicably has no role and which they have not even indicated will be reviewed by your agency to make sure it is based on facts and science. And if this weren't all bad enough, after your testimony before Congress last week, the president said you were, quote, confused, that you made a mistake and had given incorrect information. All of this raises serious concerns about the agency's decision Monday to put out guidance with new information on how this virus is transmitted, only to immediately reverse course and pull it down. And Dr. Fauci, you've been a trusted voice on public health issues in this country for decades. Yet, the Trump administration officials have tried unsuccessfully to dictate talking points to you and undermine your credibility through opposition research and in an op-ed. The president himself even retweeted a message calling for you to be fired. Any of these examples of political pressure would be alarming on their own, but together they paint a clear pattern of interference that is downright terrifying. The Trump administration didn't just start its political interference yesterday, and we are not going to expect them to cut it out tomorrow. So Congress has to make it stop. The president has made it painfully clear where he stands when it comes to picking between politics and science, politics and public health, politics and the safety of our country. Now, each of us has to do the same. Yesterday, Senator Schumer and I, along with over 30 of our Democratic colleagues, introduced the Science and Transparency Over Politics Act. It will create a task force to conduct a thorough investigation into political interference in our public health agencies. And I do hope every Republican who has spoken out about how important it is we stick to the science will support that bill. Because you cannot stand for science if you will not stand against political interference. I'm also going to be asking our witnesses more about this as well, because it's so critical that we know what political pressure they've been under and what is being done to resist it. Finally, Mr. Chairman, as this may be our last hearing this Congress, I want to recognize again the work we've done together on this committee in your time as chair. The list of major bipartisan bills we have gotten signed into law over the past few years, you know them: Every Student Succeeds Act, 21st Century Cures Act, Opioid Crisis Response Act, Perkins CT reauthorization, and more. The kind of bipartisan approach we used to get those bills passed is going to be critical if we are finally going to take the steps we need to take to address the pain of this pandemic, which is why the current state of discussions to pass more much needed relief is so frustrating. Republicans didn't offer anything for months. And after they finally put forward a proposal, they didn't even sit down with us to move towards common ground. Instead, they moved further away from us with their next proposal. After all the success we've had on this committee, I think we've shown by example that is just not how bipartisan negotiating works. So I'm not done pushing for Republicans to come back to the table on a new COVID-19 package, put partisanship aside, put our families first, and work together to respond to this pandemic with the kind of sweeping response that is so clearly needed. Thank you, Mr. Chairman.